You're watching Port Charles on Kane.
I'm fine, Eve.
Are you sure?
Just tired. Listen, what's going on?
We are pretty short-handed down here in the pit tonight.
Ah, and in this weather, the good folks of Port Charles will no doubt be playing bumper cars.
Yeah.
We're gonna need some coverage down here.
Okay, I'll be right there.
No, delegate. You've already put in your 12 hours today.
Listen, a few more is no problem.
Fine, you're the boss. But listen, drive carefully. The roads are very bad, and they are only getting worse.
Okay, be there.
I'll radio the ER.
What are you doing, man? That hurts.
Hey, gotta stop the bleeding, man. Hang on.
How about a shot or something, man?
As soon as the hospital gives me the okay. But right now, you gotta hold still.
We're the idiots that ran me off the road. They hit and run?
No, they called for help.
En route with early 20s, male in distress, auto versus motorcycle. Victim was struck and thrown, sustained a laceration to the right thigh, possible arterial bleed. Estimated blood loss 200 to 500 cc's. Direct pressure being applied. Patient is coherent and in pain.
Okay, Squad 40, this is GH417. I copied your report. Start 2 large 4 IVs, high flow, O2, and C-spine.
Pain meds?
If systolic stays over 100, give him morphine.
Oh, mama, this hurts.
How high can we go with it?
Not more than 10.
All right, ETA 2 minutes. Squad 40 clear.
We'll be waiting.
That kid who fell off the Elmsford Bridge?
Yeah.
He has no insurance.
So what do you want to do, throw him back in?
No, I'm just saying.
No, don't just say, okay?
You know, this bad weather really creates a lot of foul moods.
Oh, hey, lady, you're a wreck. I don't think we can help you.
I can't possibly look as bad as I feel.
Oh, don't tell me. You want another 10 rounds with Joe?
Give the lady a cigar.
What's up with that? I would think after the strike, all that other stuff would have been sorted out by now.
Yeah, well, we sorted it out all right. I just don't want to talk about it. I need to get to work here.
Oh, gee, so does the guy that we don't want to talk about.
Man, how old are the shots in this thing?
What do we got here?
Car side swiped him and laid down his bike.
Yeah, some fool in a Beamer just...
Okay, hold that thought, my man. Let's get him into trauma 1. Coming through, get that door. Coming through.
Pulse is 126.
Somebody do something. I'm bleeding to death.
He was calling for his mama.
Need my mama out of this.
You ever lose consciousness?
Well, we kept hoping, but no.
Funny, man.
At least those hearing's okay. How's that pain, huh?
With this sucker hitting every pothole and
On my count. 1, 2, 3.
How do you think?
Welcome back, Joe.
Thank you.
What do you mean back? Where's he been?
Yeah.
Can we get a doctor here that's got some experience?
Gloves. Thank you. I am home. Boy, it doesn't get any better than this, let me tell you.
Hey, guys. Can you hang for a minute? We have a 3rd degree going south, and you guys might need to move him to the burn unit at Mercy.
Gives me a chance to let that nurse in ICU shoot you down again? Go ahead. So you've got to be pretty happy.
I do.
Having the great Joe Scanlon back to work.
Yeah, how did we ever limp along without him?
Oh, Karen, hi.
Hey, you guys are here pretty late.
Well, we were in sort of an accident.
What? Are you okay? Were the girls with you?
No. They're at home. We were run off the road by a motorcycle.
Yeah, they said the kid was brought here.
Yeah, they brought him here a little while ago to examine him. Listen, I should check you guys out. Why don't you sit down?
No,
we're fine.
We're fine, really. We're
fine,
just a little shaken up by all this.
Yeah, I mean, I don't know what this kid was thinking on this motorcycle. He was an idiot. I mean, it was raining buckets out there.
Okay, listen, why don't you take a breath and I'll go check on him, okay?
Okay, thanks.
It hurts.
We already gave you morphine.
You could have fooled me.
But do you think we should call a vascular surgeon?
I don't know. Maybe all we have is a little pumper. Let me check it out.
All right.
Here, hold on.
Hey, watch it.
Okay. That bad?
Yeah. Not just the leg, man. My neck, all over and back. You know how heavy a beam is? Right?
How's he doing? He says he's in pain all over, but we can't seem to find anything broken. I'm waiting on the x-rays.
The Woods?
Yeah, what's it to you?
Alex Garcia. Detective Alex Garcia, Port Charles PD. Look, I need to ask you a couple of questions,
Yeah, well,
okay?
you know, I don't talk to cops without a lawyer, all right?
Really? Sounds like you've been here before.
No, I watch a lot of TV, all right?
Look, all I'm doing is filling out an accident report. You got a problem with that?
Yeah. I got a problem with you assuming it was an accident.
You saying they hit you on purpose?
Okay, I'm not saying nothing, all right?
If you want to talk to the people driving the car, they're right outside.
What could be taking them so long?
We're just trying to be thorough.
Well, at least the guy was wearing a helmet. Thank goodness.
Well, you gotta wear a helmet. It's a law, but you know what? They should invent some kind of thing for people on motorcycles that just covers their whole body so that nothing can happen.
Yeah, might have saved his leg, huh? That's pretty bad. You know, we shouldn't have been on the road right then, at that moment.
Yeah, the guy came out of nowhere.
No, I'm not saying it's us. I'm not blaming us. I'm blaming that Rachel person.
Ah, that echoes back to my original thing with you. Your hunches. I'm the one that always gets in trouble.
That's it. This is not my fault. It is Rachel's fault. If we weren't out chasing around trying to find out what she's up to, we would be at home in front of the nice wood stove with our two girls instead of chasing around in a downpour, find out information about Dr. Devil Diva. Oh, hi. So what's the news? How's the guy?
Well, no life-threatening injuries, but we'll know more when we see his x-rays.
Oh.
Dr. Wexler?
Yeah.
I have an ASAP for you. It's
Okay.
Peds.
Great, thanks. I'll be right back.
Okay.
Hey, what's up, Christy?
Thanks.
The kid is insane a lot. You want to tell me what happened? How fast were you going?
Wait, no. Now, wait a minute, right there. We were not going fast at all. Mr. hugged the wheel, squinting over in the rain. You know, he's very careful in the rain. In fact, it was almost flooding. He had to go that slow. It was flooding.
Yeah, there was a lot of traffic, and then, so I went around this guy on the motorcycle, so I thought he was behind us.
And then all of a sudden, out of nowhere, he comes and veers right in front of us.
You know, then I turned. I guess my bumper caught his back tire, because we went this way, and he went down the other way.
I'm so mad. We were almost there. We were this close to getting there.
Getting where?
To, you know, where we were going.
And where was that?
Oh, listen, Garcia, have you heard of a place called the Van Wyck Institution?
The mental hospital? What were you going there for?
Well, we were going to visit some of Lucy's relatives.
Leg's not broken.
He's still in a lot of pain, he says.
I'll order some more pain meds. In the meantime, this leg needs to be sutured.
I'm volunteering you on that one.
What? Me? Why?
I'm a little rusty.
Oh,
I am.
full of it. Do you think this lacerated thigh is just looking for a free fix?
Well, there's no needle marks, no symptoms of withdrawal. Tox screen negative. What do you think?
Well, I think it could be just a lot of moaning and groaning.
Hmm.
But I don't want any trouble for this hospital.
Yeah, your lucky day.
Not yours. I'm going to need some help with him. He's got a mouth on him.
Well, before I forget, the nurses are throwing a party tonight at the recovery room. I want to thank the residents for standing up to the administration at the end of the strike.
I guess that wouldn't include me, though, would it?
Come on. Are you kidding? All the scabs who crossed the picket line? You're my favorite. But you might get a little flack from the others. You're a tough guy, right?
Well, yeah, I guess I am trying to present a kinder, gentler me, yeah.
Oh, an evolving man. Very nice.
Oh, I'll get you that suture tray.
Mm-hmm.
Nurse Goddard, 212 East.
Hey, what are you still hanging around here for?
Picking up an extra shift.
Well, you gotta be whacked out from the last one.
I can handle it. Besides, the extra money comes in handy.
Article 7 of the Paramedics Handbook says all personnel should be in good working order.
The chief resident doesn't seem to have an issue with it. You know, it's you she seems to be having.
That is not up for discussion, Frank, especially by you.
Yeah, well, for once you know how it feels.
All right, Lee, I can't get a signal on my cell phone, so I'm at the ER. Phone, I can't talk. No, everything's fine. I'll call you when I can. Bye.
Dr. Rodriguez, 2715 East. Dr. Roland Rodriguez, 2715 East.
Oh,
Oh.
sorry.
No, I'm sorry. Glad to see you're all in one piece.
Yeah. Are you talking about the accident?
Yeah, I am. I know it's pretty unnerving to hit someone with your car.
Well, you know what? I'm not suffering any psychological damage here, so I don't need any help.
Well, if you change your mind, I'm available. You know, I believe GH should offer psychological as well as physical help to their patients.
Well, now that sounds like some campaign speech.
Yeah, actually, if I did have that seat on the board, I would be able to put some of my plans into play.
That's kind of a scary thought.
Come on. Are you sure you want to subject Lucy to possible embarrassment?
What are you talking about?
Well, they're going to interview each candidate. I mean, to see who has the depth and experience to determine hospital policy.
Well, my money's on Lucy.
I should have known it would have been. You're a loyal guy. I'm sorry. I probably overstepped my bounds.
That's okay. May the best man win.
Yeah, may the best woman win, anyway.
Oh, yeah.
So, I hear you were on your way to Van Wyck Institution when you hit the cyclist.
Yep.
Why? I have a couple patients there. I know my way around.
All right, we're on it. Karen, that multi-vehicle TC is coming in. It's a man and a woman. Okay, Raj, give him a hand in the bay. Eve, take command to one. Jill, assist Eve. I've got the woman in two. Let's go. All right, let's go.
Dr. Curtis, 5.
Okay, let's take her to 2.
Dr. Fritz Curtis, 5.
Going to 1.
Okay.
Hi there, welcome to GH. You didn't have to get all dressed up just for us.
It hurts.
I know, we're going to take care of it. What's your name?
Tim Snyder.
All right, Tim. On my count, guys. 1, 2, 3. All right, the blood pressure's 120/90.
And it's been stable since we scooped him. He's got shortening with rotation of the left leg and some rib tenderness on the left side.
Okay, probably a fractured femur.
Okay.
Jill, we need to get some chest x-rays and CBC. All right, got it.
Need a hand here?
Yeah, get a history.
Here you go. Use that, thanks.
Okay, Mr. Snyder, is it Tim?
How's Kathleen?
They're checking her out right now, actually.
We just got married.
Yeah, I think the dress gave it away. So you were celebrating, huh? Having a little champagne?
Kathleen had a few glasses. I don't drink anymore. 4 years sober.
Oh, good for you.
It was raining so hard I couldn't control the car. Can I just see her for a second?
Mr. Snyder, can you wiggle your toes for me?
Yeah.
Good. All right. Good news, Mr. Snyder. Your wife will be okay.
Thank God.
Yeah, we just need to clean up her cuts, and then she'll be able to come in and see you. So, if everything's okay in here, I'll start the paperwork. Was there a slight chill in the air, or was it just me?
I didn't notice any temperature changes.
I did. Lady Dr. frosted the place.
Patient's not only conscious, he's very aware.
So what's her problem?
This guy right here?
We were kind of going out for a little...
Kinda.
Okay, it's over. Can we change the subject, please?
You know, it was over between Kathleen and I at least a dozen times. Look at this now.
Okay, let's try this. Let's pretend that you're the patient and I'm the doctor for a little while, okay?
I liked his idea better.
Eve.
What? Mrs. Snyder? Hi, I'm Dr. Lambert. I'm one of your husband's doctors. How is he? Well, he is stable right now, which is good. He has a broken leg and maybe a few cracked ribs. We are waiting for the x-rays to come back from the lab.
But he's going to be all right.
Well, we're not allowed to make any promises around here, but I think so.
Tim and I used to say we'd never make promises. Nothing's certain, so why pretend?
Oh, well, this is not pretend. It's beautiful.
The whole wedding was beautiful. I really need to see him.
In a few minutes, okay?
Hey, Eve.
Yeah.
You know anything about that guy on the motorcycle?
Yeah, he's gonna survive. How are you and Lucy doing?
We're okay. What about the kid?
He'll be okay.
Yeah? Well, that's a relief.
Oh, don't be so sure.
Why?
Well, I'm not supposed to say anything.
Wait a minute, what are you talking about? Is he paralyzed or something? Is he going to lose his leg?
It's doctor-patient confidentiality.
Come on, will you just... What? What's up?
He is saying that he's in an extreme amount of pain. And we can't seem to find a reason why.
Okay, so in other words, it's a good thing I'm a lawyer because I'm going to be needing a lawyer.
Something like that.
Thank you, Eve.
You sure there's nobody I should call?
There's nobody.
All right, suit yourself.
Are you Jamal Woods? That's what it says on the tag.
I'm Scott Baldwin. I was driving the car that you cut in front of.
Oh, so you're the guy that tried to kill me. Oh, were you here to finish a job or something?
So what are you're saying I'm responsible here? It's my fault. Is that
Look,
what you're
I'm
trying
not
to say?
saying nothing to you, all right? So why don't you just beat it?
What's the matter? You in a lot of pain there?
You know what's worse? I'm lying here thinking about all the things I used to like to do. Dance with the ladies, ride my bike. I may never do those things again.
Oh, I think you'll be back doing the foxtrot real soon.
So you want to see how hurt I am? Huh?
No, I already talked to the doctors.
Why the hell is anybody discussing my condition with you anyway? Isn't that, unethical?
Unethical. I like that word.
Mm-hmm.
I do. It's a big word.
I'm young, I'm black, I ride a bike. Which one of those makes me stupid?
You know what makes you stupid? The fact that you were riding your bike like that in the rain.
Yeah, well, you know, my Beamer's in the shop.
Yeah, well, you shouldn't. You should have taken it easy, you know, slow down.
I had to be somewhere, man.
Where? The only place you were headed to was the morgue.
Well, anywhere I was going before you decided to teach me the rules of the road.
No, I did not cause this accident.
Well, you got your story, I got mine.
I got a little news flash for you. I'm a lawyer, so I'm good at conning people, too. This is a no-win situation for you. You got it? Good.
Look, there's no need in dragging this out in the courtroom. So how about we try this again?
Okay, let's go.
Can you spell settlement?
Carol, I see you. She wants me. Hey, she almost dumped a bedpan on your head. I was getting under her skin, though, right? Right. Hey, any word on that burn victim?
I'm sorry.
You told us to stick around in case you had to move that guy to Mercy.
Oh, yes. Okay, he's stabilized, so they're keeping him here. I'm sorry, I meant to tell you guys.
Falling asleep at the switch?
It's been a long night.
Seems like more than that.
3 words, okay? The Scanlon brothers. Though Joe, at least, isn't in my face all the time.
Uh-oh. Burned.
Did somebody say you were cute?
Let me guess. She enjoyed her at it again.
Yeah, same old, but usually she's cooler about it than that.
She's beat. So am I. Let's go get a cup of Java.
All right, let's go.
Raj, I'm going to admit the patient in 4, please. They're ready for him up inside.
Okay.
Okay, thank you. Lizzie, I heard you were in an accident.
You heard that already? I bet you were so disappointed when you called that morgue and you found out I wasn't laid out in there flat.
You really do need to talk to someone about this paranoia of yours.
Did you just diagnose me that quickly? That is so amazing.
You know what? It's not too hard to call with someone in your position.
My position. Okay, I'm standing up here, much to my chagrin. Okay, I'll bite. What position?
Let's see. You decided to run for a seat on the board. In way over your head. Pressure's getting to you. You're even starting to chase down my patients in the middle of the night. I tell you to be careful. But you've already had an accident.
I did. And look at me. I'm right here, standing right in the position of upright. I'm a survivor. So don't you worry. I know exactly what I'm doing.
Just to be on the safe side, though, I'm going to keep my eye on you. That way, if I see you stumble, I can get you the help you need.
Thank you. You know that expression, physician, heal thyself? Oh, doctor, that applies to you.
You're watching Port Charles on KNTV 11.